by the American people as the next president. And I vow to honour our country's sacred obligation. To all of our proud veterans, know that I will be a commander-in-chief who respects your sacrifice, understands your service, and who will never betray the values you fought so bravely to defend. I will never treat you or your families with anything less than the honour you deserve. So Joe Biden paying his respects there, but paying due attention to the ongoing political row in the United States over his presidency, the presidency that he won at the election and that Donald Trump doesn't recognise. Donald Trump himself, actually, several miles away, is due at the Arlington Cemetery in Virginia. Very shortly, his motorcade due to arrive there soon. But, you know, in terms of the military, Joe Biden, of course, his son Beau Biden fought as part of the US military, served in Iraq. His son Beau, who subsequently died of cancer. And the military and a president's relationship to the military has been an ongoing point of contention throughout the election campaign. You'll remember that Donald Trump referred to, well, in 2018, he had referred to US military who died during the war as suckers and losers. It's something he denied, but it was a controversy that he had to carry with him throughout the campaign to him. And Joe Biden made the point in debate, in television debate, that he regarded that partly as a personal insult. So that was then, that was the campaign. Subsequent to the campaign, which of course finished with Biden's election victory, we have the ongoing discussion, the ongoing mechanics and machinery of government transition, a machinery that is not yet in motion because of Donald Trump's obstruction. We're not expecting, given this is a Veterans Day visit to the Arlington Cemetery, we're not expecting him to make any kind of public statement. It's the first time we've seen him, Gamal, since Thursday in terms of formal public engagements, but he has been vocal on Twitter, insisting still that he won the election, talking about counts that are yet to take place, and laying heavy emphasis on the legal action that ensues, a legal action that so far has taken the Republican Party nowhere. They haven't had any success in front of the various judges who have looked at the complaints they have made. Interestingly, the New York Times this morning is running an article saying that it has contacted every state in the country and every Secretary of State who presides over the counts and the ballots, stands by the integrity of what took place last week and knocks back entirely any notion that there was a miscount, even if there were some ballots that have ultimately to be spoiled or looked at again. It wouldn't fall within the category or within the numbers that would make an impact on Joe Biden's victory. So, you can see pictures from Arlington Cemetery there. The rain still pouring down on a very dreadful day here in the United States capital. Clouds gathering over Arlington, clouds gathering over Donald Trump as he continues to deny what many see as the inevitable.
James, thank you. Some breaking news, and the UK death toll from COVID-19 has now topped 50,000. It's a figure the country hoped would never reach, but that scientists had warned was coming. It makes us the first in Europe to hit the milestone and the fifth in the world. Live to the newsroom, and our health correspondent, Ashish Joshi. 50,000 deaths, Ashish. This is a significant moment.
It's significant, it's sad, it's tragic, and many people, especially the people, the families, the loved ones who are mourning each and every single one of those 50,000 deaths, would say was preventable. There will be time later, Gamal, for a closer analysis of exactly what the government's handling of this pandemic, whether any of those 50,000 could have been saved, and whether they should have been saved, and whether there should have been more protection for the vulnerable, for the elderly, and those who are at highest risk. But this news comes at a time when we are on the cusp of a breakthrough. We are talking about a vaccination program which will take us out of this crisis. That there is so much hope on the horizon about what is to come, but this is a sobering reminder of exactly what the human cost of this pandemic is. Every time we talk about numbers and we talk about data, we put these on a graph, we have to remember that every single one of those 50,000 lives is a person who's died because of COVID-19. And sometimes when we're looking at all the figures, that gets lost, but it's there. It's always there. It's a reminder every time you speak to a frontline health worker or a grieving family member that this is indeed a grim milestone. And remember, right at the back, right at the beginning of this pandemic, when we heard those predictions from the government's advisors and the Prime Minister that we were to lose very many people, we were talking about tens of thousands of people. I remember each and every milestone. I remember the first death, the 1,000th death, the 10,000th death, and now here we are in a second wave, and it's here, and we've already hit 50,000, and sadly we will continue to lose more lives.
Does increase pressure on the hospitals and health service, which you've seen firsthand?
Yes, I spent the whole of yesterday in an intensive care unit in Coventry, talking to patients and staff. And while I've been covering this pandemic, there have been moments which have made me step back and almost hold my breath. And yesterday was one of those moments. We went through the first wave. There was a lull in the summer when we climbed off that peak, and societies began opening up again and communities began to open up again, and we thought really then that we were through the worst of it. And then we were warned a few weeks ago that infection rates were rising across the country, and this was leading to more hospital admissions, and inevitably those hospital admissions would lead to more deaths. And sadly that is very much the case. I was in an intensive care unit and I saw some very, very sick people. Some of those patients are holding on for dear life, and the staff there are trying the very best they can. And it's really important that when we pause to remember those 50,000 lives, we have to remember too that each one of those lives was being looked after until the very end by a dedicated team of healthcare professionals, doctors and nurses, who have given their lives to making people better. But these were 50,000 lives they could not save. So the emotional impact on each and every one of those frontline healthcare workers is incalculable. Listen to what Dr. Chris Basford had to say when I asked him about the emotional impact it's had on him treating patients in intensive care.
It's never easy. Sometimes it is difficult. What I can say is that this is a team that knows what they're doing, and if you have a patient that you have cared for to the best of your abilities, and you know that you've done everything right, and they still didn't make it out of the intensive care unit alive, then that sometimes is something that you have to accept, and you have to try and leave that work and not take home with you. It's difficult. It is. It certainly can be. Some patients are more troubling. So, for example, for a lot of the nursing team, you have a young woman come in, a young woman who's got young kids, and that's exactly what the cohort that most of my nursing team are in. That's really hard, and the team will struggle with that. Having said that, it's also hard when you've got someone who's got grown-up kids, and you know that it could be your mum and dad who's that sick as well. So there are times that it can be hard, but that emotional something about that particular patient makes it very hard to leave that at work.
And when I stood in that intensive care unit, I started to think about all the arguments that so many people have been putting forward, suggesting that the COVID-19 is some sort of conspiracy, that the hospitals are empty, that people aren't dying. I can tell you that the scenes I saw yesterday will dispel all of those myths. We are in a second wave, more people are dying, and it's a very difficult time for very many hospitals, especially in the northwest. And now as that infection rate spreads further south, it's going to be a very testing time for those hospitals and the staff, and especially those patients who are in those units.
And Ashish, in the last few minutes, we've had a statement from Dr. Yvonne Doyle, the Medical Director of Public Health England. She has said, sadly, the upward trend is likely to continue, and it will be several weeks before any impact of the current measures and the sacrifices we are all making is seen and is reflected in the data. There is still some way to go.
I think that statement spelt it out in black and white, that there is no ambiguity in what has been said. It's a fact, and you know, when you speak to these doctors, and they'll tell you that we've been watching these infections rising over the past few weeks. It hasn't just caught us by surprise. We've expected this second wave. We've got ready for it. We're trying not to postpone elective care. We're trying to keep all of our services going because we realise just what a damaging effect it has on people's health. They can't go to the hospitals, but Coventry Hospital, where I was yesterday, they're determined to continue all of their services, as well as dealing with a spike in coronavirus admissions in their intensive care units. They're seeing some of the sickest patients in the region transferred to that hospital. They are also seeing a rise. They've said to me that winter has arrived. They are seeing emergency admissions rise. So that emergency admissions with non-COVID patients, COVID patients, and keeping or trying to catch up with the backlog of elective operations and procedures and care. So that gives you an example of the perfect storm that is facing so many of these hospitals, which are under so much pressure right now. And the interventions we've seen over the last few weeks, including the national lockdown, well, there's a lag. Those interventions will have an effect. They will slow down the spread of the infection. They will break that community transmission. But sadly, what we're already seeing in hospitals are very, very sick patients already there who need critical care, and sadly, some of those patients will not make it.
Okay, let's take a look at today's figures. Further 22,950 new positive COVID-19 tests have been reported in the past 24 hours. Another 595 people have died within 28 days of testing positive for the virus. It means that 50,365 people have now died within 28 days of a positive test. Let's just remind you of the rapidly rising numbers over the last few months. At the start of the pandemic, 20,000 was the number the government's chief scientific advisor, Sir Patrick Vallance, said would be a good result. We breached that a month into the first lockdown on the 25th of April. By the 5th of May, just days before the Prime Minister announced an easing of lockdown measures, we were at 30,000 UK deaths. And as fears were growing of an impending second wave, we reached 40,000 UK COVID deaths on the 5th of June. Well, Deenan Pillay is a professor of virology at UCL and a member of Independent Sage. He joins me now. Thank you for joining us today. Your reaction to the news that we've now reached 50,000 deaths?
Well, it's a shocking number, and it puts us pretty high up in the league table, a very bad league table of deaths per head of population. As you've said, success would have been keeping death numbers less than 20,000. Therefore, it's clearly a failure. And we've got to learn from this and ensure that by the time we come out of the current lockdown, we are really well prepared with a group of measures which can ensure that we keep infections low and therefore death rates low in the future.
And with the arrival of news about this new vaccine, it is a sobering reminder of how far there is to go.
Absolutely. Of course, we've rejoiced in a beacon of good news this week with the early results of the vaccine. But of course, there's a long way to go. There's a need to distribute this to those who need it. And of course, there are other vaccines coming down the road. And Jonathan Bantam, Deputy CMO, has quite rightly warned us that this is not the silver bullet. We do need all of the public health measures in play in order to keep infections low. And we've got to learn the lessons that, in fact, the mistakes that were made following the previous lockdown earlier this year, where over the summer months, really, the opportunity was there to put into place a really good test and trace public health-led system that could keep infections very low. That did not happen, and for that reason and the lack of prediction of what would happen when schools opened and universities opened, and we're now feeling the cost of that. So we have now got to make sure during the next few weeks that we really have some system in place to ensure that when we come out of lockdown, we've got a far better test and trace system than we now have, the ability to support those individuals in isolation. And in that way, we maximise the benefit that we get when the vaccine finally does come around.
A lot of lessons that need to be learned clearly. What is the main one for you?
I think the single best thing that could happen would be what is called NHS Test and Trace, which is a key component of an integrated public health structure, comes out of the current dysfunctional management that clearly there is under NHS control and integrated with local authorities, and that £12 billion that have, that's available for that project is distributed to our existing structures. And I must say, I'm pleased to see that the same mistakes are not being made with the vaccine rollout, and that vaccine rollout is being clearly embedded within hospitals, within primary care, and I hope that sufficient money is going into those systems to allow that to be delivered. But that is the way that we need to deal with this. It's a public health emergency, it's a pandemic, and we need a really strong public health-led approach to deal with it.
Deenan Pillay, many thanks indeed for your time. Well, the Prime Minister is reacting to the news that COVID deaths have now exceeded 50,000. Let's have a listen to what Boris Johnson's had to say.
Every death is a tragedy, and we mourn everybody who's gone, and our feelings are with their families and friends as well. It is a global pandemic whose effects, whose treatments, whose implications for the economy all those have been becoming clearer and clearer as the months have gone on. I do think that we've got now to a different phase in the way that we treat it, and after these tough autumn measures, which I hope people will stick to really rigidly as far as they possibly can, we're very much hoping that two things will start to come to our aid. Number one, the mass testing, the kind I just described, the rapid turnaround testing, and then the other thing is now the prospect, the realistic prospect of a vaccine. So you have a kind of, as it were, two boxing gloves to pummel the disease in the weeks and months that follow. But I've got to stress that we're not in the woods yet. It does still require everybody to follow the guidance, do the right thing to suppress the disease in the way that we all understand.
Let's go live to Downing Street to speak to Sky's political editor, Beth Rigby. Beth, we heard from Boris Johnson just there, but this will place further pressure on the Prime Minister.
Yeah, I mean, what a grim milestone we've hit today, and it's one certainly the Prime Minister, his team and everyone in wider government hoped that they would never reach. Indeed, it's a milestone they didn't think they would reach. Sir Patrick Vallance, the chief scientific advisor, saying back on March the 17th that he thought the death toll from COVID-19 would be far lower than where we find ourselves. Let's have a little listen to what he originally predicted.
Every year in seasonal flu, the number of deaths is thought to be about 8,000 excess deaths. So if we can get this down to numbers 20,000 and below, that's a good outcome in terms of where we would hope to get to with this outbreak. But I mean, it's still horrible. I mean, that's still an enormous number of deaths, and it's an enormous pressure on the health service.
Right,
20,000 deaths would have been, to quote Sir Patrick, a good outcome. 4 months later, on July the 16th, he admitted that the figures had been far worse than the government had anticipated, and he said it had not been a good outcome. And of course, this weighs very heavily on the shoulders of the Prime Minister. And
whenever it could be 9 o'clock,
why that death toll was higher than expected. Was it because in the first lockdown the government moved too late to introduce the lockdown measures? Was it because too many people were discharged from hospital into care homes and that spread the virus? These are, of course, all very, very deep and serious questions that the government will have to answer at some point. But the Prime Minister there also with some slivers of hope in terms of the second wave. The good news is that it doesn't appear to be as deadly as the first wave was. And then, of course, the Prime Minister there talking about mass testing and talking about the hopes for a vaccine, hopes that maybe we won't have to go into a third wave. So there is cause for some optimism on what is a very, very dark day in terms of the COVID journey that we have all been on these past few months. And just in terms of putting the figures into context, you can't mix them any other way. They are truly awful. When you look at it in terms of the globe, in terms of Europe, the UK has the highest death toll. France and Spain coming in at 52,000 deaths. I should say that if you adjust it per population, you adjust it for population, the UK doesn't fare quite so badly. But if you look at the globe as well, we are the 5th worst performers, if you like, the 5th highest death toll across the globe. And these are, of course, really, really bad figures. The government, I know it weighs heavily on all ministers who have been trying to avoid this, and it will no doubt be central to that inevitable public inquiry into how the government handled COVID-19 that we expect to come next year.
Okay, Beth, thank you. Well, the United Kingdom hasn't always been united in its COVID response, at times taking very different approaches to lockdown. Our correspondents are live in all 4 nations of the UK. In Scotland, Sky's Gerard Tubb is in Edinburgh. In North Wales, Lisa Dowd is in Wrexham. Our senior island correspondent, David Blevins, in Belfast. But first, light to Sky's in Manchester. Into.
A real grim statistic coming out now, 50,000 deaths, and the bulk of them here in England, across this country, which has now seen 44,304 deaths to COVID-19 throughout this pandemic. A very stark figure, one which we never thought we'd see right at the beginning of this crisis, but here we are, 44,304 deaths in England, and behind them, attached to every single one of those deaths, is grief and sorrow and a story of a person who's lost their life to COVID-19. Breaking that down a bit, here in Manchester in the northwest of England, they've seen 8,580 deaths, and rapid testing here continues just on the grounds of the Etihad Stadium. Behind me, they continue to try and find more cases to get on top of the virus, to get control of it, to suppress the number of deaths. But the reality is still pretty grim here in the northwest. The highest number of cases in the country still coming from the north of England. They're seeing a high number of hospital admissions, intensive care unit admissions as well. So as Beth mentioned, there may be some hope. That hope will be incredibly cautious, because the situation in the north of England in particular and across the country is still looking pretty grim.
Okay, Inzi, thank you. Well, Sky's Gerard Tubb joins me now from Edinburgh. And Gerard, has there been any word from Scotland's First Minister?
Well, Scotland, of course, has forged its own way with coronavirus restrictions, and Nicola Sturgeon is very much saying that people need to stick with the system they've got now. So to recap what they have been doing, since September, no one in Scotland has been able to invite friends or family into their home that they don't already live with. And then for most of October, the highly populated Central Belt had all of its licensed premises shut down. And then when England went into
when it abandoned regional restrictions and went into a lockdown, Scotland brought in its own regional restrictions, 5 tiers from 0 to 4 at the beginning of last week. Nowhere is in tier 0 and nowhere is yet in tier 4, but the central belt is in tier 3 and that is very similar to England's tier 3, except cafes, restaurants are open during the day, licensed bars are shut, but everywhere has to close at 6 p.m. Now, 3 new areas will go into tier 3 at the end of this week: Fife, Perth and Kinross and Angus. And there is a real suggestion that there may be areas going into tier 4, which is a lockdown, possibly next week. Now that causes problems, of course. If you have a regional lockdown, how do you stop people moving around? Well, Nicola Sturgeon has said that she is drawing up laws to change the advice not to move into a law not to move from one tier to another, and has said that those laws will be enacted if necessary. The number of deaths in Scotland, that number has gone up by 64. There are 1,235 people in hospitals across Scotland with COVID-19. Officials are not complacent. That chart of cases has flattened, but they don't yet know whether their restrictions are working as well as they can. There are 93 people in hospital in intensive care with COVID-19, and all eyes are on whether that chart continues to flatten and then fall.
Gerard, thank you. Let's go to Sky's Lisa Dowd, who joins us from Wrexham. And Lisa, this news comes at a time when Wales is trying to move forward after its 5-week lockdown.
The First Minister, Mark Drakeford, called it a grim milestone when they passed 2,000 deaths since the start of the pandemic here. Well, that figure is now 2,108. On Monday, they came out of that 17-day and the government here...
Hey doctor, can I stop? Chasing the deadline, the cut-off time for the Waymail courier service.
Lockdown has ended. There are still some restrictions in place, and they include that people should be staying out of each other's homes and gardens,
easy.
except in limited circumstances.
I think going around the 50 parcel
Cafes, bars and restaurants have
day.
reopened here, but you can only go to them in groups of 4. And actually where I am in Wrexham, we're not far from the English-Welsh borders, and it may well be...
So that's it from the Here Doctors in Ashton-under-Lyne, Manchester. We shall see you soon.